Hello and good evening. It is me again, Caroline, your host, and I'm happy to be back once again with you. And I hope you are having a good Friday tonight and you are ready to find out a bit more on another topic that we are going to discuss today. And just let me remind everyone that we are gathering here every single day to support you through this difficult time that we are all in, as I believe that you are now waiting for your treatments to start or continue. So hopefully that will be possible for you very, very soon. And we are just simply here to help you out a bit as much as we can, of course, with all our live events. And tonight we have another online patient meeting. And I just want to mention that all of our online patient meetings and IVF webinars are brought to you thanks to our ambassadors and partners as well. So, as always, I just want to thank them for their support and joining our initiative, which is, of course, called Stronger Together. And tonight we have another special guest and expert, and this is Andris Abele. Hi, Andris. How are you feeling today?
Hi, Carolina. I'm feeling well, and hello, everybody who is joining our webinar.
Happy to have you with us tonight. And I just want to mention that Andres is actually a certified urologist and infertility specialist at Clinica EGV, which is located in Latvia. And tonight he will discuss the topic on sperm quality and other reasons to be worried. So, as always, we will start off with his short introduction and then some most common questions that we receive from the patients. And after that, remember, this will be time for your questions. So all you need to do is just type in those questions in the chat section so that Andres can help you with this a bit. And remember that you can ask anything you want to. So I encourage everyone to use this opportunity and ask your questions. And I believe we can start. Andres, are you ready to begin in such case?
Yes, and thank you, Caroline, and thank
Excellent.
you for inviting me to present this topic. Um, yes, I work in urology since 2008, and it's already more than 10 years. I specialize in male infertility. It's um, my topic that I really um, liked and specialized. And I treat um, couples, not only male, but also a little bit female. But of course, I'm a urologist, so male infertility is my major topic. Performing diagnosis, ultrasonography, treatment of patients as well, open and endoscopic surgery, including TESA, PESA, microtesa, and so on. So, and I'm here to actually tell a bit more about this topic of male infertility, about the sperm quality and what's happening with that in males, because we have heard and we have a lot of information about female infertility, but for male, it's a little bit less. So my goal is to share the data I have and to raise awareness about several aspects of male infertility. So I hope I will also answer your questions. So that's my introduction, and we can start with the questions.
Excellent. Thank you so much for that introduction. We definitely want to spread the word and simply advise and hopefully also provide some more details on sperm quality. And let's start with the most common questions. The first one is right here. What are sperm quality and fertility rate trends in the world?
Um, yes, I would say we can divide world in two parts, and that's way science is looking at it. Um, we have Western world and other world. And by Western world, we usually understand North America, Europe, Australia, and New Zealand. And in a recent study that investigated sperm quality trends in past 40 years, we can see that in the Western world, sperm concentration is declining for at least 50%. It's a huge number. So by half in 40 years. And the problem or the issue that this decline is not stopping. So it will go on for next years. And if we not change something, it will be dramatic burden for healthcare. If you're looking at the data from other world like South America, Asia, and Africa, in those countries, decrease is not so significant, and in some subpopulation, it's even increasing.
Excellent. Thank you so much for answering the very first question. Next question is right here. So, what is spermatogenesis and how is it regulated?
Yes, spermatogenesis is a process of developing the sperm. We know that it's happening in testes, but it's not only testes that is involved. So um, also epididymis is involved in this process. So basically, spermatogenesis lasts approximately 60 to 70 days. So by that time, changes one generation of sperm. And the good news that for male sperm cells are developing actually all um, all life. It's starting from puberty and it's not stopping till the death actually. Of course, the intensity of spermatogenesis is changing. The maximum or the best results in 20, 30 years. After 35, 40 years, sperm quality is decreasing by age. Uh, After spermatozoa is developed, its storage, it is storage actually in epididymis, and their sperm undergo further maturation where they acquire increased motility and of course also enhanced capacity for fertilization it's needed, yeah. And after that, sperm are stored in epididymis until ejaculation. If you are looking what hormones are um, in regulating the spermatogenesis, so those are three main hormones. It's very likely like woman's FSH, follicle stimulating hormone. It's a LH, lutein hormone, and it's testosterone. And those hormones are impacting two main cells within the testis. It's Sertoli cells, which actually develop the sperm, and Leydig cells, which are developing the testosterone.
Perfect. Thank you so much once again for answering the next question. And we have this one. What are the main facts and causes of male infertility?
Um, yes, and these are some things that we actually need to know before we are starting to go into details. Yes, if we are looking at the infertility, then we have to know that infertility is a pair inability. We are not talking about male or female. It's a pair inability to conceive pregnancy. And conceive pregnancy within a 1 year of regular sex life. What it means? It means 2 to 3 times per week without use any contraception. As it is a peer diagnosis, yeah, we have to understand that not only female should be consulting in the case if natural um, pregnancy cannot be reached, but also a male as well needs to go to specialist, and it's usually andrologist. And if the partners do it at the same time, then it's much faster. We can get result. Uh, Approximately 15% of couple faces fertility issues. One half of them it's due to male factor. I believe in future there will be more and more couples facing the fertility issues. If you remember, we look at uh, sperm quality issues, and it's still a problem, especially for Western countries where we also, if you're looking at Europe, it's also a case for Europe. Yeah, uh, 1/3 of all male infertility case, we cannot say why it is. So it's called idiopathic male infertility. What it means? It means that a lot of still is not clear in the field, and a lot of studies is still ongoing, and I believe also in nearest future we will have more and more information, and therefore we can help um, a lot of patients to get the pregnancy. Uh, what what else? I already mentioned the age of the partner. It's not all. It's not only the female age which is important, but also a male, because after the age of 35, several processes begin in the body that increases sperm DNA fragmentation, for example, as well as stem cells starting to dying slowly. Therefore, we have to be very careful with planning our family. Yeah? If we are delaying this decision to late 30 or 40, then there is more probability to get some issues with natural pregnancy due to male factor as well. One of the cornerstones of the male infertility tests is semen analysis. Yeah? And this is actually the first analysis which we are usually start to look for if we are looking at the male. But not only semen analysis needs to be checked. Yeah. It's of course assessment of all body, of all diseases in history. It's a proper physical examination that needs to be done. Um, Further investigation for endocrine, genetic, and maybe other tests. That this is something that we do during the visit, case by case. Yeah. If
All
you are
right.
looking, yeah, one
Okay,
more.
sure. Go ahead.
Uh,
Sorry.
if you are looking at the probability of the natural pregnancy by looking only at semen analysis, then we can predict approximately only 60%. Yeah? Because there's a lot of other things that needs to be taken into account besides semen analysis. So therefore, I really encourage not to look only at the semen analysis, but to look on the whole body um, health as well.
Okay, perfect. Thank you so much for providing the details for this question as well. Next question is how to understand semen analysis parameters.
Yes. We have to understand that semen analysis is individual. It's very hard to look at them and then compare like one patient analysis with other. All we have to look like for one individual case. Yeah, and semen analysis is changing. Sometimes it's better, sometimes it's poor. Yeah, and it's affected by ejaculation, it's affected by gonadal activity, by laboratory analytical errors. So therefore, I suggest if you do semen analysis, do at the same laboratory. And in order to get the good results, yeah, you need to do at least 2 semen analysis with an interval of 3 months. That's obtaining by absence of ejaculation 2 to 4 years, 2 to 4 days. And if you if you look at the real semen analysis, you see a lot of parameters that's shown here. But basically, there are 3 main that you really need to look for. And it is sperm concentration. That's according to WH minimal reference values, it's 15 million milliliter. Second is progressive motility, which should be at least 32%. And the third is sperm morphology that needs to be at least 4%. Again, if you see the semen analysis and you see that all parameters is within the normal reference values or range, then unfortunately it doesn't mean that everything is okay. From other side, the semen analysis shows very well if some of the parameter is below the reference values. For example, sperm concentration is not 15 as it should be, but like 13 millions per milliliter. Then we can say with 95% probability that there will be a problem with natural conception. If those parameters combine, like low sperm concentration, low motility, and low normal sperm morphology, then even bigger chance of not getting natural pregnancy within 1 year. Yeah. Therefore, um, when we look at this semen analysis, you have to consider that it's showing a probability of natural conception, but if it's within normal ranges, it doesn't mean that everything is okay.
All right, perfect. Thank you so much again for explaining how exactly we should look at those. Well, next question is right here. So, why do we need sperm function tests?
Um, yes, previously I talked about the semen analysis. So it shows from the male perspective how much sperm we have. Is it motile or and is it with normal morphology? But semen analysis doesn't show anything what happens with those sperm when it has been already in a woman's body. Therefore, the science go further and look at the sperm functional tests. And nowadays, I would say it's already like must have in all fertility clinics to do not only basic sperm or semen analysis, but nowadays we should do the sperm functional test. Why? Because the way how spermatozoa is going to the oocyte in the woman's body is quite complicated, and there are also a lot of things could go wrong. Yeah, therefore uh, we should look also in more details. And one of the most used sperm functional tests nowadays is DNA fragmentation assay, as well as, for example, oxidative stress assay, HbA test, or MAR test. And there are a lot of more, but those are the most common tests that are done, I believe, across Europe.
Perfect. Again, thank you so much for this. And we will slowly starting with your question. So I just want to remind everyone that if you have any, just go ahead and type it in. I do see some questions already. So that's good. And so, of course, let me go to the next question. What kind of assisted reproductive technology to choose from for from a male perspective?
Uh, yes, thank you for this question. Uh, we know there are three main assistive reproductive technology that are used nowadays. The first, the most simplest one is intrauterine insemination. The third, in vitro fertilization, and the second and the third was intracytoplasmatic sperm injection. In fertility clinics with significant male factor for infertility, usually we use the third. It's ICSI called. Yeah, and which method to choose from the male perspective depends on semen analysis. And here we have to take or look at the two main factors. The first, the total sperm concentration, and what part of those spermatozoa is really motile. So it's called um, progressive motility. And if this part of spermatozoa is more than 40 million, then intercourse or the natural conception is the best way. If it's less than 40 millions, but not less than 5 millions, then you can choose intrauterine insemination. If it's less than 5 millions or even zero, then usually we go for IVF, in vitro fertilization, or ICSI. I would say nowadays ICSI has shown that it's um, show the best results. So if you are going to fertility clinics, this will be the main procedure that will be uh, with most probability offered for you.
All right, perfect. Once again, thank you so much for explaining this. And now we will go to our last question when it comes to most common ones, and then we will go right to your questions. So the question is, so what are the testicular biopsy types?
Yes. In case if in a sperm analysis there is no spermatozoa, then we have to do biopsy. Yeah, and we have to understand that nowadays there are several biopsy types, and one is a very simplest. It's called TESA. It's testicular sperm aspiration. It's basically a um, needle biopsy done under the local anesthesia, or short intravenous anesthesia. The second is testicle sperm extraction. It's already a small operation, but I would say the best option nowadays for azoospermia, especially for non-obstructive azoospermia, is a microteaser. It's the same sperm extraction, but done under the microscope. And this has shown the best results of finding the spermatozoa if there's like very low probability to find anything. Yeah? Therefore, we combine open surgery with microscope.
Excellent. Thank you so much for answering those questions. And well, now it will be time for our patients' questions. There are a few already here. Well, in such case, Andres, are you ready to go ahead with the
Yes,
questions?
yes, of
Excellent.
course.
Happy to hear that. And so let me start with the first one that we got. There are like three parts of that. Okay, so I will start with this one. My husband has had three semen analysis. His concentration has its 4 million. His morphology has ranged from 0 to 2, then highest being 3. And so, what do you think a urologist would recommend? What would you recommend for us? And also, there is additional information. He is 38, I am 37, and also as a young child, my husband had a undescended testicle which was corrected at his age of 4. Would this be also the cause?
Uh, yes, very good question. And I would say I, I see quite frequently very similar couples. Yes, answering the last question, most probability that understanding testis is the main reason for such semen analysis. But I believe this is not the only cause. There should be something more because we have two testes, and if one is not working properly, then other can work perfectly. Yeah, and in this case, semen analysis should look much better. Therefore, um, definitely there's some more reason behind that. What I suggest to go for consultation to urologists or to andrologists as soon as possible because it's already after 35 years. So with each month you will be delaying your decision to go for to specialties, then the less probability to help you. Yeah. Therefore, please do not hesitate to look for help in such case. In most probability, um, medical assisted technique will be used to help you with pregnancy.
All right, perfect. Thank you so much for that question and for your advice, your recommendation to that as well. We have another question ready. It's quite a long one, so let me start right here. My husband and I have three frozen sperm samples, but only the most recent one in the US in 2018 has had the infectious disease test. The sample we want to use with the best quality is a slow frozen assisted 2007 sample in Australia, but didn't have an infectious disease test within 2-3 months that most clinics require. I was told it was not the protocol that the clinic follows partners for wives. As I've had multiple miscarriages, we'll be using donor and a surrogate, but the closest infectious tests were done 6-7 months beforehand, which prove neither he nor I have ever had any infectious diseases test. And there is another part, okay? So we can provide all blood tests since then, before then, and do more blood tests now if necessary. We don't want to fresh sample as he's older now, so possible risk of children being born with autism dwarfism. Professor Don Evanson, who invented the DNA fragmentation test, uh, to use this sample as it is the best quality from the others. Can an infectious disease test be done on frozen sperm to prove it? It is clear of any disease? If so, which body country should I approach to send them a vial to test? Quite a long one, but I hope you can. I will go back to the first part, okay, for you.
Okay.
Excellent.
Yes. In all cases, I always suggest to use the fresh sperm. Yeah, uh, because it shows much better results, even if the patient is getting older. If you are talking about the male patients, so in this case, please try, from my perspective, to um, to make better the sperm, and I believe your doctor can help with that. Yeah, and to try to conceive a child with a fresh sperm. If you see then that this is not possible and you have to use a frozen sample, then you have to do the frozen sample. Then it's no other possibilities. Yeah.
All right, thank you so much. And so, if I just might add, okay, so I think the patient has added something. Okay, um, so he's 54 years old
Yeah.
right now. So
Yeah.
even though,
It's no problem. Yeah. Yeah. It's you can be the male could be 60 or 70. Yeah.
all right, thank you so much for that question. Definitely lots of details and for your recommendations as well. Okay, next question is right here. So if sperm motility is low but the other parameters are within normal range, does ICSI always overcome this issue or could it still affect ICSI success?
Yes. The short question, yes, ICSI overcomes this issue. It's true. Yeah. So I would suggest to do the ICSI if this is the only problem. But from other aspect, if the other parameters are good, then to do the best you can to increase motility. Yeah, and therefore again you need to go to visit your urologist or andrologist to trying to find the reason why your motility is affected. There should be some reasons behind this.
Okay, excellent. Thank you once again for that. Now, next question again, it will be a bit longer one. So let me just to show you here. Okay, so my partner has a 35% average sperm count result for from DNA fragmentation. Sorry, fertile range 0 to 26%. Will having a higher sperm DNA fragmentation really affect the quality of the embryos or chance of getting pregnant naturally? My partner drinks alcohol at the weekend. Will this have a big impact on his sperm quality? We have a 4-year-old naturally conceived since we have had 3 fed fresh cycles, 2 miscarriages where we only get 1 embryo from 15 eggs. My partner has now been put on a 40-day doxycycline course. How do antibiotics improve the sperm quality? Thank you.
Thank you. Yes, DNA fragmentation really affects um, the quality of the not only embryo but how pregnancy is developing, especially at the first weeks. Uh, it has been proven with many studies that patients with high sperm fragmentation, as here, yeah, um, then it's less probability of natural conception and much greater um, probability of having miscarriage, as it already happened here. So my advice is again to look for the reasons why DNA fragmentation is so high, because definitely there is reasons behind this, and you should avoid those reasons. Um, about the alcohol consumption during the weekend, I always suggest my patients to use as little as possible the alcohol, because it's not only the problem with alcohol, it's a lifestyle problem. If we are using alcohol, we are less moving, we are not doing sports that time, we are usually sitting, and with alcohol, smoking is a problem, and eating habits is also not very good. So therefore I see that it's a complex way that you have to look at this, and you have to encourage your male partner to visit a doctor. If you are looking at the doxycycline course, then uh, if the problem was infection, yeah, because antibiotics are usually given if the problem is some kind of infection, bacterial infection, yeah, then definitely it will improve. But you have to take into account that doxycycline will actually decrease sperm um, quality for the first 3 months, and it will get better only starting from the fourth or fifth months. So please do not be patient, yeah, and do not how to say what do not wait for your pregnancy 3 months after finishing um, antibiotic courses.
All right. Thank you so much again for your question and your advice on that. And well, I just want to see and just make sure that you have asked all your questions. We will be slowly finishing, but I just want to definitely make sure that you do. That you have any questions. If not, we will finish. However, I would like to add something because we also receive, and I believe that lots of patients ask you about that as well. And what about the supplements? Because many times I know that the patients might ask you, what kind of supplements would you advise to take? To is it working? I mean, and to improve the sperm quality as well. Anything you can say about that?
Yes, I would say in general, supplements are beneficial for male infertility. But if you are looking at the big clinical trials, then it has not proven that by using only supplements, it will help to overcome male infertility. So you have to be very careful with that. It's a big business nowadays for supplements, and if you go to pharmacy, you can find supplements basically for everything, including male infertility. What I like to say that please, it's important not only to drink or to take those supplements, yeah, but it's important to change your lifestyle, and you have to move, you have to quit smoking, you have to do sports, you have to reduce your alcohol consumption, you have to look at the way you eat, you have to eat more vegetables, more fruits, yeah, less meat, more fish, and therefore um, uh, do not what Do not wait that this one tablet or capsule will do a magic for you. It will do very little for you, but sometimes it really helps. Therefore, by individual cases, um, when it is when it is prescribed by a doctor, it can help you.
All right, excellent. Thank you so much for answering my additional question as well, because this is definitely important, and I believe many people, of course, and lots of our patients have been asking about that. So thanks so much for explaining this as well. Definitely something to remember. And someone is actually typing, so I just want to make sure that we will answer all the questions. So let's give it a minute and make sure that we see the question. Yes, here it is. So let me just go ahead with the question. Is there a maximum amount units of alcohol per week to keep optimum sperm quality? At what point does it start to significantly drop off? Thank you for the
Yes,
question.
yes, it's 3 to 4 units of alcohol per week. If you are reaching this, if you are taking more than 3 4 units per week, then be it will decrease sperm quality. And not only the sperm quality, it could actually affect the offspring as well. So be careful with the alcohol, especially if you are planning a family.
All right, thank you for clarifying that as well. Definitely something to remember as well. Take home messages from here we have definitely. Okay, I'm just waiting and to see if there are any other questions. If not, we will be finishing. Yeah, just one more question is right here. So let's have a look. Is it true that you need to leave at least 48 hours between ejaculation to ensure better sperm quality?
Yes, it is true. Yeah. Um, in the first of part of my speech, I told that it's important to keep the regular sex life, and it means 2 till 3 times per week. And it's actually means that it's like every 48 hours. Of course, in real life, it can be changed. Yeah, it could be 74 or 24 hours. It depends on the couple. Uh, for my patients, I always say, do it as do your sex life, the frequency of your sex life, if your private, um, how to make deal, yeah. But if you are planning your child, please do not, please do it at least 2 till 3 times per week. Um, Therefore, um, please do not be afraid. Yeah, and if you want to do it like more frequently, like every day, no problems, because there will be a good spermatozoa even if you will have uh, 24 hours, yeah, from one sex to other. Um, but in majority, yeah, it's 2 to 3 days. Yes.
All right. Thank you once again for explaining that. And thank you for the very interesting question indeed as well. Perfect. Okay, I will have to check. At least at this point, we do not have any questions. But if you have any, just go ahead and type those in. If not, we will finish for today. Yeah, just one more questions popped up here. Is it true that thick sperm are more qualitative?
No, I would say no, because the quality is not measured by the thick. Yeah, you have to look at the concentration, you have to look at the motility, you have to look at the morphology. Um, yeah, those are parameters that shows the real quality. Yeah, uh, the spermatozoa uh, um, is in with liquid, and this liquid is produced by a prostate. The thick sperm could be due to some prostatic issues like inflammation. Yeah, therefore it's not only it's not only this reason that shows equality. So um, this is not true.
Okay, thank you again for that. Next question is here. Is it true that slower sperm is better?
No, no. The fastest sperm is much better because much more probability that this spermatozoa will get to oocyte much faster as the slowest one. So the more fast spermatozoa, and it's called category A, you have, the more probability that natural conception will happen sooner. The more slower sperm you have, the longer you will have to wait for the pregnancy.
All right, thank you so much once again for clarifying that. And for your question, I'm just waiting, and as I cannot see any questions yet, but I just want to make sure. Just let me know if you have any questions left. If not, we will finish for today. But I can already say thank you so much for today, for your questions, and actually for your expertise, Andres. That was definitely interesting. As I already mentioned to you before, we definitely should have more topics like this because this is important. This is actually, as we have discussed previously, it's not as much discussed as when it comes to infertility in women. So we should definitely spread the word. And so I would like to thank you so much for today, for your time. And is there anything you would like to add?
Yes, thank you, Carolina, again once more for addressing this topic. And um, I cannot cover all topic because it's really a huge one, and we didn't mention the major problem that some part of patients has called azoospermia. Then there is actually no sperm at all. Yeah, and but it's rather a huge topic, and maybe some other day. So thank you for all participants. Thank you for your questions. Very interesting one, and keep in touch.
Thank you so much, Andres. Thank you for that. And actually, as you mentioned, possibly we might be able to have another webinar on azoospermia, as you have suggested that it's a long topic. We will see, of course, but definitely would be interesting to find out, of course, a bit on that as well. And as you can see, the patients have already would like to thank you as well. I just definitely want you to see. Thank you very much. That was helpful. So
Thank you.
thank you once again. And I just want to remind everyone that if you would like to have some more details or would need some more advice, you can also use this link I have just sent to you. That way you will be connected with the Andres and his team from EGV, and I'm sure they will be happy to help you out as much as possible, so you can use this. And well, that is it for today. Remember, this has been recorded, so of course you will still have a chance to rewatch it and of course share it if you'd like. And if you follow us on our YouTube channel or Facebook or Instagram, that way you'll be updated with all of our upcoming events. And also, well, remember, we are having another event at 8 p.m. UK time, this time about fertility preservation. So I hope you will be able to join us as well. Uh, we will this time go to another doctor that is located in London. So I definitely encourage you to register for our webinar if you haven't done it already. And Andris, once again, huge thank you for today. Have a lovely weekend, everyone, as well, and take care. Thank you. Bye.
Thank you. Bye.
Bye.